Hi, it's estimated that tens of millions of men, women, and children are suffering from temporal mandibular joint (TMJ) or temporal mandibular disorder (TMD). Many of whom they have no knowledge about it. Headaches and pain are most common complaints for those who have afflicted by TMJ. At around 80% of the patients with TMJ disorder complains about headache, debilitating headache, and over 40% of of some kind have some kind of like facial pain. Hi, welcome to Stress or Stress Free. If you haven't met yet, my name is one second here. My name is Vincent Moon, where I help people like you stay stress free by changing one habit at a time. Okay, and today's topic is we're going to be talking about what TMJ relief. TMJ relief. In this video, I'm going to share with you what is TMJ joint and what causes TMJ disorder and the symptoms, and of course, but last but not least, I'm going to share with you how to get relief from there. Okay, and yes, if you kind of like know everything, but you want to go to the go to where the treatment is or the relief is at the end of this video, or if you're watching the replay, we have the timestamp on it, and you can go ahead and click on the TMJ relief. All right. Okay. Let's go. All right. We smile, laugh, talk, chew. These all are our facial movement, right? And sometimes we do this daily, and don't think about it. But if you have your temporal mandibular joint dysfunction, the TMJ or TMD, those movement may cause a lot of pain. All right. So let's see what is the temporal what is the TMJ, temporal mandibular joint. What is TMJ? Let me see. Let me pull out. Okay, let me just pull this out here real quick. We have that over there. Where's my face? Oops. Why is it so small? Okay, I know why. Oh, 1 second. Let's adjust. Okay, right here. All right, temporal. Let me just change the blue. All right. So temporal mandibular joint is where is it located? Basically, let me show you right here. Let me just take that off first. Okay. Basically, it's around here. All right, where if you in the middle of the ear, this is the if you right in the middle of the ear, you have the tiny thing on the middle, right? Let's right here. Okay. Okay. Let me just point right here. This is that's one you can feel a bone right there, right? Oops. Let me just turn off the writing. Okay, clear that first. All right. This point here. Oops. Right here, there's a bone here, and also, and then there's another bone here. This is your kind of like jawbone, right? So this is the temporal. This is where the skull is, and that's the first one here. That's this one. Let me just point, change color. This one here, this one here is called the mandibular. All right, mandibular bone, and then your lower jaw is the lower jaw. Let me just lower jaw is the blue one right here, the blue line. Let's go to the blue line. Lower jaw right here. Okay, so the lower jaw is the other part of the bone. So and the temporal bone, which is on the side of the skull. Okay, all right. So when you move, right, just take that away. When you move up and down, like you move your mouth up and down, right? Up and down, you know, and also sideways, up and down, sideways, and then what? And then you go. How do you grind teeth? Like this, right? Okay, so this help you do all those movement. That's the temporal joint. And let me just come back here again. So, and the muscle. Oops, I should have left it there. All right, you have the temporal, the mandibular, and then you have the jaw, right? Okay. So when you the most of the muscles are right here around this area here. That's the muscle attachment right here. Okay, this are the whole red area is where the muscle is. So when um, the side tightens up, right? One second, yeah, lose my thought. All right, that's the joint. So that's the joint that's connected to the lower jaw and and the temporal bone, right? Okay, so what kind of movement again it does? When you bite, you chew, right? You go up, down, sideways, right? Sideways. Okay. All right. Let me just take that away. All right, and so that's what the that's what the joint is, and those are the movement. You can go forward, backwards, sideways, up and down, right? Okay. So what causes TMJ disorder? What makes that this whole area here uh, doesn't work, right? What makes that doesn't work? Okay, the causes are immune autoimmune disease. Which when the your body immune cell system attacks the healthy tissue. Okay, and you also can get TMJ by infection and also injuries to the jaw. May accident got hit by a car or something. Or somebody throw a football and hit on your face, and then move your jawbone a little bit, or some dental procedure that you know that makes happens to be like open your you have to open your mouth too long, and then you get the TMJ on that from that. Okay, and also sometimes during emergency they insert the breathing tube before the surgery. Sometimes they can mess that up too, or various forms of arthritis. Okay, so what are the symptoms of TMJ? Well, of course, pain in the jaw muscles, right? And then what happens is, you also can, with the tightness here, you can get your neck and shoulder pain too. And most common one is headache, because why? When this area is so tight, you just pull the muscle and just triggers the headache up here. Okay. Of course, then the one of the symptoms is also the jaw stiffness. The muscles here are so tight, and then you cannot move. Okay, and then you have limited movement limited movement or the jaw locking up. Okay, and also one of the symptoms are ear pain, pressure, fullness, ringing, and of the ear, like tinnitus. Okay, and then the other symptoms is grating in the jaw joint when opening and closing the mouth. Okay, and then when you bite, it feels like something is off. Of course, it's going to also cause some dizziness, and also because of the tightness here, it might cause some vision problems too. So those are the symptoms. So what should we how let's say you have TMJ, right? What should you avoid? All right. So number one, you have to avoid like bad habits like nail biting, right? Some people like to bite their nails. My daughter do that all the time. And if you have TMJ, you're gonna hurt because you're just chewing it and chewing and chewing and chewing, right? Or chewing cheeks and lips. You go like that. Okay. All right. Or resting your jaw in your hand on your hand. That creates the pain too. Okay. All right. Clenching your teeth or grinding your teeth, right? And also muscle pushing that sometimes people like to, I don't know why they like to push their tongue push the tongue against the teeth, and make sure if you have all this kind of pain, make sure you take notes, and then when you see the doctor, let them know, so that, and then also tell them how often you do that, and that will help. Yeah, uh, help the doctor diagnose, or help the doctor figure out what's going on with you. All right. So what do you have to avoid? You need to avoid doing stuff, right? Because you have TMJ. So avoid yawning or yelling. When you yawn, you open your mouth, right? Make sure you try to like uh yawn, small yawn, not open too big, right? Or yelling at people, yelling at people, and then that's create the um that's exaggerate more the tightness and the pain on your TMJ, right? Okay, and then of course, avoid taking large bites of food. If the food is too big, then you're going to hurt your hurt your jaw. Okay, so, and also, uh, how do you say it? Stop eating food that have you need to chew long time. Like sometimes you chew on a piece of meat that's like have tendon on it or something. You take too long to chew, or chewy meat, right? And also basically chewing gum. So stay away from chewing gum if you have TMJ. All right, let's go to some of the non-surgical TMJ treatments. What do you think? What do you think? What do you think they would suggest, or what do you think they you should? What kind of treatment do you think you should do, or non-surgical treatment for TMJ? Put down in the chat. Let me know. Okay. All right. Of course, first of all, Eastern medicine. You put heat or cold packs on the pain area on your TMJ, right? On either shower side is aching, right? Okay. Of course, you can um, eat soft food, not hard food, right? Take medication. Medication usually pain relief, but you know, it's better off not taking it, because antacid and stuff will create more other problems to your body. All right. Or you can wear a splint or a night guard. So basically, they both help you to correct your bites, and make it adjust it so that the uh, your when you bite down, your bite is good and not crooked, right? Okay. And also, the difference between the splint and the night guard is, night guard you only wear it at night, right? That's why it's called night guard, right? Duh. And splint is the one that you have to wear all the time. Okay, so you need to, if you need all this, you just have to put it in on all the time. So it helps to readjust your bite, and also release the tension on the TMJ. Okay. All right. Or you keep your jaw resting. How? Like resting, you keep in the resting position. Minimize the jaw movement, so that you don't cause it to hurt, right? Such as chewing. Minimize those. Minimize chewing. Minimize yawning. Minimize singing and yelling. So if you like to yell and you have TMJ, please don't talk, don't yell. Okay. All right. So you're gonna do your best to keep the muscle as relaxed as possible, right? Okay. So basically, those signs and symptoms, the causes and stuff. So, how do you when it comes to massage relief? When it comes to TMJ relief, what do you do? Put down in the chat. Let me know what you do if you have TMJ before, or somebody had TMJ. What do they normally do? Okay. All right. If not, I'm going to show you some trigger points that will help. Okay. So basically, let me just put my face back again. Boom. Okay. Let me just erase that. Top. All right. So there are 1, 2, 3, 4 points. 4 points are all on the side of your, let me see, just let me just draw it here. All around here, this area here. Oops. All around this area here. Okay. So let's start with point number 1. Let's see, which color should I put? Blue. Okay. Let's take blue again. Point number 1 is triple warmer 21. Where is triple warmer 21? So let me just show you on me first. All right, if you turn on the side, right, your curve of the ear is the beginning part of the right at the joint where your ear and your ear and head connect. And let me just pull it out here. So it's right. Oh, you can see right here. This point here. Oops, too far. All right. This I'm using my finger to do it. So let's see if I can make it correct. Okay. So right at that point there where your ear connects to your face. Okay. Right. That's triple warmer 21. That's one of the points. And then next thing you want to find is uh small intestine 19. Small intestine 19 is very simple. See that there's like in your ear, like you see there's like tiny button kind of right here. Let me just show you right here. Right there. Oops. Okay, right there. There's a tiny button, right? Let me just remove that and show you. See that tiny button there? Oh, I could erase the other one. Okay, that's see the tiny button right there? Right there. Okay. Not I'm too far out. Right there in the middle. Right here. Oops. Right there. Okay. Yeah, that's the tiny button. So that's small intestine 19. Okay. Not forgetting right here, the corner here. That's the triple warmer 21. And next thing we want to find is the gallbladder 2. Gallbladder 2 is very simple. It's the end of the ear. So basically, if you pull your ear, right, at the end, the tip, pull the ear, let's go a little bit front, like this point right here. Oops, not right there. Let's go up a little bit. I'm going to erase it and it's going to, well, okay, let me see. Okay, undo it right here. Right there. That's the point. Right there, it's called gallbladder 2. All right. Gallbladder 20 is the back and 21 is in the back. This is one of the favorite points for headaches too, right? Okay. The next thing is you want to find stomach 6. Where's stomach 6? Stomach 6 is basically right down here. If you feel the bone that's down here, right in the middle, is this stomach 6. Right there. Undo it. Okay, let me just use another color right here. Right there is the stomach. It's a little tricky. Oh, right here is the stomach 6. Still gonna get it. My finger is too big. Too low. What? All right. Oops. I just cut that point right there. All right, right there. Okay, that's stomach 6. So basically, is let's take this chart away. So basically, if you turn sideways, right, it's up here. The first point, triple more 21, and then right in the middle of the ear, that dot right in the middle, or that button. Okay, is Staten Island. Stomach, small intestine 19. Okay, and then we have right at the end of the ear, a ear loop right here at the end. In front of it is called gallbladder 2, and then if you follow your jawline down in the middle, so you come down, it's kind of like stop a little bit right on there, come down, let it stop a little bit, and then that's stomach 6. So stomach 6, gallbladder 21, at the end of the your ear loop, all right, and then small intestine 19 is on the button here, right in front of the button, and then triple warmer 21 is right on the corner of the where your ear attached to your face. Okay, all right. So very simple. You can just with pressure point, you can just put pressure on it. But let me just show you one more time. Okay, so you want to put pressure on it, right? But basically, this is the area, and down this area here is where the tightness is, right? So you want to first of all you just put pressure on those points first, okay, and then afterwards you want to massage this area here, and then down the jaw too. All right, let me just show you how to do it. Okay, let's do it. Let's do it. Let's do it. All right. First of all, just let me show it from this side. So you just basically use one finger or two finger. Of course, always when you massage, always use a finger pad, right? So that it's soft and easier to press, and you can put pressure on it. So basically, you don't have to go exactly to the point, but you go roughly around the area where your pain area is, and then you just put some pressure, and then do a circular movement back and forth like that until we want to do like until you feel the tension goes away. All right, and then, you can feel it too. Sometimes when you start working on it, it's really tight, and then when you keep moving it, keep doing circular movement, and then you'll feel like the area becomes softer and softer and softer. So you start from here, go down, basically just down the jawline this way, okay? Down the jawline this way. So you just start from the tip of the top of the ear, on the tip on the tip, the joint on the your ear, where your ear joint touches the face, okay? So the corner of the ear touches the face, you just go straight down. And then you will find like some tightness sometimes, but then some area is loose. So it's fine. Just work down along that area and find the tightness. And usually when you have TMJ, this area here is tight. So along right in the middle of the ear where the dot is, that's the not stomach, small intestine 19. That's where the tightness is. So you just go across. Go across towards the eye, towards the cheek, basically. So that's where you can feel the tightness there. So you just want to rub across there. And once that area is loosened up, then you go down to the jawline, like here, jawline, and then you go down to stomach. Stomach 6. Stomach 6 is usually always tight because that's where your your jaw, you open your jaw, right? You go like this, like this. So it's usually tight here. All right. And last thing also is you need to release the tension, the behind your, kind of like behind your skull, the side. I mean the behind. This is the side of the your face line, right? Kind of like behind your face line. Kind of. You need to go behind your ear. Just rub down this way. Use your the side of your thumb, so you can just go down this way. Just go down, so you can just loosen up, or you can use the pad of your thumb to just go down like such. Just kind of like loosen up the area. Okay, all right. So that's one. That's one that way that you work on the pressure point, right? The next one I want to show you is you just basically work on the whole area. And let's see. Let's go back to the other. Let's go back to my face there. So now you want to work on this whole area here, okay? Because the tightness is here, and then here too. So, let's do it. Let me just clear that off. All right, let's do it. Okay, so you want to work on the whole area here, this area here, right? So basically, you want to, once again, same thing. You just do circular movement. You can find where the tightness is. Find where the tightness is, and then once you find the tightness is, right. Remember, I always like to show you the one way that you can do it, and then do the lazy way. Okay, so you feel the tightness there, right? Let's say you feel the tightness here, along the mandibular bone. So you just put some pressure in there, and then what you do is drop your jaw like such. See, if you drop the jaw like such, you can feel like the where you can feel your TMJ joint, the move. So your temporal mandibular joint move, right? So that's where and then you can see when you move, you can feel like you go detect which area around or by the side that is tight. Then you can just put some pressure there and then move it around. And at first it might hurt a little bit, and as long as maybe the more times you do, and move it around, not so hard. It's because you're having pain, right? So you just put a little pressure on there, just do slowly, and then you will feel the area loosen up. Okay, so what you want to do is just um, go around the area and then try to feel it. Try to feel where the pain is, and if that's the tightness there, just tight. Let's say if you feel tightness there, just same thing. Put some circulation. Do circular movement, or just put some pressure on it, and then just drop the jaw down. Move, do some movement like we said. Uh, Up, down, sideways. Okay, sideways. So you can just move the. Make sure the muscles is moving. So when you put the pressure there, the muscles you will definitely feel the muscle loosening up. Of course, first of all, you don't have to open your mouth so big because you have the pain, right? Your TMJ pain, right? So you want to do slowly, put some pressure and do slowly, okay? And then just detect around, feel around, and then see any tightness spot. Just put some pressure and then move your jaw. 1 second here. Today I have Hong Kong black tea. Pretty good, very good. All right. Yes. So once you around here, you're done with this area here, right? Your the mandibular bone. All right. You want to go down the jawline because down here too. Down here is all tight too. So basically, you want to go slowly. This area here, attack the top area first of the jaw, and then you want to move slowly down, and then to the stomach 6, and then you see anywhere else is tight. So let's do it. All right. So basically, once you're done with the mandibular bone right here across your ear in the middle, and then you just come down a little bit and then feel it, feel for the tightness. Basically, massage and basically massage and pressure points. Just look for tightness and just loosen it up. So and the idea is you break down the tightness, and then what happens is when you break down the tightness, right, you bring circulation to the area. And then when you bring circulation to the area, that means you bring blood to the area. When you bring blood to the area, and then it brings oxygen to the area. When you bring oxygen to the area, then you got no pain. Simple. So that's whole idea of massaging is like, basically there's a stuck area there. You want to loosen up the stuck area, bring the blood there, bring oxygen there, and you're done. Okay? But make sure after every massage or before massage, make sure you drink a glass of water, a glass or two of water to hydrate the muscle. And then after massage, make sure you do a couple of glasses of water again to flush all the toxin that we broke down, or all the tightness that we broke down. So if not, it's going to stay there, and it's going to, after the massage you feel good, but then the next day you're going to feel pain. Okay. All right. So basically, we did the below the slightly below the ear. Now we're just going to go down the jawline. Same thing. Now put pressure, and then you just drop your jaw a little bit, and then up, drop the jaw a little bit up, and then, or you can up here on the jaw up here between the joint, right? Usually it's tight at the joint, so you put some pressure there, and then go down, up, down slowly, and then that will help release the tension, right? So basically, you work the whole side. So sometimes you have in the TMJ both sides hurt. Sometimes it's only one side hurt. So it all depends, right? And don't forget the back here, the back of your face, or the back of the jawline. All right. So you go same thing again. You go down this way, or you can just go down. Just use your finger pad or side of your side of your hand on the pinky side, right? Down here, the cushion part, the fleshy part. You just go down this way, like such. Come down this way. So basically, just sweep it down. Kind of. When you sweep it down, it's also you draining some lymphatic the lymph node too. So it's drain some lymph to the lymph node, and then that will help release all the tension, and also take out some of the stuff that you don't need in your body. Okay, all right. So basically, that's it. So you can, if you have both sides, same thing. You have pain, you can do the same thing for the both sides. All right. Okay. If you have any questions, please put down in the chat so I know. And yeah, if you have any questions, put down in the chat. Let me know. Okay. Let me just go to the chat and see what's going on here. Still said. What is still said? Legs are tired. LOL. Oh, what happened to you? Still, were you walking a lot? Yeah, that's what I said. Tired from walking? He said yes. Yep. Okay. What did you do? You did a lot of walking today, and I see some of your pictures on. You sent out the pictures. So yeah, nice day to walk, I guess. Black tea is good. Yep, black tea is good. My friend does a very, 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 very tasty, very, very tasty, very, very, very good black tea. What he does is put rose tea and black tea mixed together, and it's the best. But we usually drink it with milk and sugar. But I'm trying to cut down my sugar, so I drink only milk with that. Okay, and it's really good. And if you want, you can put some make some boba in there. Boba, boba, right? The big bubbly thing. All right, you make some in there, and it's better than the one they have outside in the store. All right, walking a lot. Okay, and haven't walked. Okay, yeah, that's what happened. When you stop exercising and stop walking, and then all of a sudden you walk a lot, you definitely feel the pain. Definitely feel the pain. Yeah, it's like sometimes for me, I don't know, not that much. Let me see. It's like if you cycle, you used to cycle and then you stop cycling, and that's where you get, when you come back, try to not restore, try to do the cycling again, you feel aches and pains all over, right? So yeah. So yes. So sometimes you just need to do slow, restart it. When you restart, start it slow, not not doing too much. Don't go crazy on it, right? And yeah, that's what I was going to say too. Right? Just go down. Say here, I will walk for a while. Yep, I see. And for a week, so hey, that's not how you spell shin. I know auto spell, right? Shin splint, and I got a bit not as bad. Okay, yeah. So what you can do is heat pad. If you have heat pad, warm it up, or just take a bath. Yeah, take a bath, soak yourself in Epsom salt. Epsom salt helps, help relax the muscle. And when you're in the bath, just massage it slightly and just get rid of the pain. Basic, very easy. Okay, shin pain. Yep. Uh, oh no, that's what he said. Yeah, I drink black tea. I know boba is good. Yeah, boba is good, but make sure you don't drink those. Don't get those boba from China. I don't know what they put in there. If anything from Taiwan should be much better. Yep, I know what you mean. Shin spin, not shit spin. But it's okay now. All right. I was rushed. It was raining a bit. Oh, I see. I see. I thought you guys have good weather this week. I guess it rains a little bit, huh? Yeah, we have like today was like 20 something, 30 something. It's crazy. All of a sudden, this whole November we have like 60 something, 70 something, 80 something, and then we have 50s, and then this week we have 30s. So it's like crazy. I was in the elevator with one of my neighbors. It's like, yeah, this whole month is like crazy. I get all four weathers in November. Well, hopefully winter is not going to be too crazy. Cold is fine, but not too much snow. Too much snow is it's kind of a pain sometimes. Especially in New York City. It's like if snow comes down, it's great, but after when it melts, oh, forget it. Slushes there, uh, drain stuck and everything. So it's crazy, a little bit crazy. So And then sometimes, with the CD comes down, it comes slow to clean it up, forget it. You will stuck forever, forever. And if you park your car outside, good luck. Make sure you get a good shovel. And make sure you prepare the shovel too. So, anyways, okay. It was okay, and wasn't cold out. Okay, that's good. Yeah. But then after rain, after rain is usually it's much, the temperature just drop and it's much cooler. Oh yeah, yesterday, was it yesterday? Yesterday it was cold. It's cold. It's fine, right? But then it's windy. Oh, it's crazy. Yep. Sunny, then turned cloudy, and when I left was sunny and cloudy, raining a bit. Yep. Yes, that's what happens sometimes. It's, I come from Malaysia. Malaysia has, you will see like all day sunny, and all of a sudden in the evening, like boom, rain, rain, and after that, oops, gone. That's it. So those are tropical areas. So it feels, it's like, they like the rain, whatever they rain, and then they stop. Something like Florida, kind of. Yeah, Florida is pretty much down on the equator. So yes, as soon as I went to the park, wasn't so bad. No rain. Yeah, you are the guy that brings no rain. So they know you're going out. So they just, the rain just stop. And as soon as, oh, all right, okay, there's no rain. All right. So you're good. You're good. You're good. So yeah. Okay. If you have any questions, don't forget, just put down in the chat, so I can always answer you. And don't forget, if you're new, say new, and then we will be happy to welcome you. All right. And if you like this video, don't forget to give us some lights. Lights. What happened to the lights? Okay. Oh, right here. Okay. Don't forget to show us some lights. And this one is too small. Let's do it one more time. Let's do it bigger. Don't forget to show us some lights. Mhm. There you go. All right. Let me just adjust it a little bit. Okay. All right. We pretty much done. If you like this video, just share with somebody you know. Okay. All right. And if you want to support us, you can always go to buy me a coffee /Winston Woon to support us one time or support us monthly. Either which way, we appreciate your support. Or you can always go to Press and Soul /Stress Out Stress Free. You can check out our t-shirts and stuff, and that's how you can support us too. And of course, you can also in the of course in the bottom here, there's a super thanks. You can just support us through that way too. All right, and in the description below, I have a bunch of affiliate link. You can most of them are uh, most of them are for Amazon. And then if you buy a lot of stuff from Amazon, just click on the link, and then and if you buy anything there, it will help help support the help support this channel, and it's that no charge to you. Basically, I just get a percentage of whatever you buy, and then your price and everything will be the same. Okay, and also yes, the software that I'm using right now is called Ecamm. This for until, let me see, this Thanksgiving, Black Friday, they're having a sale. So I think it's 40% off. So you can, if you go down, click on my link, on the Ecamm link, and you check it out there. If you're interested in doing live streaming, and we Ecamm is a great company, and I've been using this for many years. And in fact, I started using it not live, but for recording, maybe about, I think they were 7-8 years ago or something. Yeah, when it first came out, and it was fun. Yeah, and I just do a lot of recording because I didn't know last time. That time was like live wasn't like the thing, so we just I just bought it, and and live was thing, but then it's not the thing. So it's like not many people go on live. So but now everyone is on live. So yes, so you can do that, and once again, I think it's 40% off for the year for membership. So as long as you're a member, it's 40%. I'm not sure, but then it's for the year, it's 40% off. So yes, and it's worth it. It's not that much money. And what else? Yeah, so they're having a Thanksgiving Black Friday sale. So go check it out. That you can use it for. I think you get a few days. I mean, a week free or something, and then you can go from there. All right. Let me see. Yeah, I mean I like going to the park for nice walk. Yep. Well, yeah, going to the park is nice. I used to go to the park across the street too a lot, and basically you get some vitamin N, nature, vitamin nature. So it helps to relax your brain. Remember, I did a relaxation on Friday. Yes. So you need some vitamin N to help relax you, and then it's something with nature that your body kind of like connect. I don't know. like they call it you connect with the earth. So basically, it's a calming thing to do. So it's good, and it helps to restore your energy, and recharge your mood too. Okay, lots of deep mud. There's sign to not go to that area, and path was quite muddy too. I see. Yeah, because of course, yeah, because of the rain, right? Yeah, but still, wear a boots, but just don't get stuck, right? Lots of nature at this one, and so close to me, and I gotta go more. Yeah. Hey, nature is everything. So nature is. I don't know what about nature. Nature is like when you just go in there, like feel relaxed. It's not sometimes when we go hiking, it's like, wow, see all God's creation, and it's like so much fun, you know, so much fun, and you just get energized from there. So it's great. That's what I think. That's why God create nature for, yeah, God creates stuff so that we can enjoy, and we sometimes we take it for granted that we just forget about it. Yeah, it's there. So what, right? Yeah. So it's like when I don't know, I was younger, right? I'm like, yeah, or see people with swimming pool, right? They all before they don't have swimming pool, like, oh, I want a house with a swimming pool. Once they get a house with a swimming pool, and then they don't swim, right? You have access to a swimming pool and nobody wants to swim, and then we don't have access to swimming pool, everybody wants to swim. Isn't that fun? Yeah. So it's basically, we take things for granted, especially Americans. They're like, we're spoiled compared to other third world country or other countries. We are spoiled, spoiled, spoiled. Yeah, it's great to have parks like this here. Yep, you are so lucky. You are so blessed that you have a park there like this. I know, right? In my old house, in the morning, like for 5 o'clock, 6 o'clock, you will hear the birds chirping already, and you can hear. It's not like only one kind. You like hear so many kinds, and then somewhere down in fall, right? There's like parakeets flying from don't know where. It's so cool. Yeah, all of a sudden you see like parakeets all over the place. I felt like I was in when I was in San Francisco one time, and I think it's also around fall. Yeah, so we step out the door, and then parakeets all over. And then I think one time we went to the city hall or somewhere close by there, and then, oh my goodness, parakeet all over the place. It's like crazy. And lately, I haven't seen any parakeets around, so it's like I don't know what happened. Somebody took it and sold it, or it's all somebody's pet now. All right, all right, all right. Okay. So if you have any questions, please put down in the chat. If not, still you have any more questions or anything you want to add on? If not, then I want to thank you so much for watching. And also don't forget to get that there. Okay, don't forget to stay stress free by changing one habit at a time. And I see you in the next video. All right.